I'm Nigel Steventon. I'm the lead matron for our UCLH at Home service. So I clinically manage the team of nurses to deliver the service across North Central London. We've seen massive expansion in not only the number of patients we're able to see, but in the range and the scope of the things that we're able to do.
I'm Deborah Glastonbury. I'm Head of Integrated Care Operations at UCLH. Safety of our patients is a high priority for the UCLH at Home service, and therefore to this end, all patients remained under the care of their acute care consultant whilst they're at home. This has allowed us to develop a wide range of pathways, including sickle cell, respiratory, heart failure, and blood transfusion, plus the normal ones of taking blood tests and doing dressings in the patient's home. The patient remains under the care of the consultant until they are medically fit to be discharged. This then transfers their care to the GP, and all information is communicated from us to the GP in the handover of the care.
So I've been with UCLH at Home just under 2 years now. I just love the flexibility. I love being outside. I just like being autonomous and kind of having my own kind of list and patients to see, and then just kind of getting on with my day. It's so beneficial for the patient because obviously they get to recover in a familiar, safer environment compared to the hospital.
I had developed a chronic infection in my kidney, and I was in the hospital receiving IV antibiotics to help control the infection. I was told I could go home if I was prepared to receive the IV antibiotics through this service called Hospital at Home. To me, it was just a fantastic opportunity to get myself out of hospital. I had spent around 3 months in and out, with the best part of the 3 months backwards and forward. So, of course, being told I could carry on receiving the treatment in my home.
We provide a wide range of care, spanning from kind of clinical input to supporting patients with activities of daily living, to even psychological and emotional support. Sometimes we can just be that person who they needed to just have a chat with and kind of just socialize with. Whilst you're under treatment and you're having care, socializing, going out becomes very limited. So essentially we become that regular person that's always popping in. So I may come just for administer a medication or just to check her vital signs, but that can be like a 20-minute task. However, I'm there for 40, 50 minutes, maybe helping her out with organizing her desk or helping her read a letter or helping her get dressed. It varies. Our role encompasses so many different things.
Hi, I'm Melanie Justiniani. I am the operational lead manager for the discharge services, UCLH at Home and virtual wards. So we have been doing a lot of engagements and promotions with the different divisions, with the different specialities. We have been doing a lot of road shows, a lot of drop-in sessions to engage with different medicine boards, surgical boards, to onboard suitable patients to the service. We firmly believe that UCLH at Home is the future of NHS. It supports the overall hospital flow. It supports the patient's care needs. It supports the patient's nursing and medical needs. And what we want to achieve is to make sure that UCLH at Home is considered daily in the discharge planning conversations in the wards.
My name is Tamina Khan. I'm a consultant in acute medicine. So UCLH at Home is a fantastic resource that we have access to, and specifically for patients, they get hospital level care in the comfort of their own homes. in the safety of their own homes with access to their family, their friends, their own support network. So what I do is I support the case finders in identifying any patients suitable for hospital at home, and I liaise with the consultants of the day on AMU or SDEC to work with them to identify any suitable patients. And if the case finders need any support once they've assessed the patients, then they call me.
So my name is Blossom. I'm the lead virtual ward case finder for UCLH. So my role involves actively screening patients' suitability to be discharged to hospital, home, and virtual pathways. I would screen the patient through the notes, or I get referrals from the consultants, from the therapist. Then I would see the patient, assess them, and ensure that the discharge and the referral is suitable, and the patient can be discharged safely to their homes.
It's expedited discharges for patients, which means that there is better flow across the emergency floor and throughout the hospital, in fact. And again, similarly for patients and the hospital, there's a lower risk of hospital-acquired infections as well.
Offering a service like UCLH at Home means that patients have more choice about how they receive their care and, more importantly, where they receive their care. It enables them to get back to familiar surroundings, to be with their family or loved ones. I feel extremely privileged to have worked with our UCLH at Home service over the years. I think the future is with UCLH at Home virtual wards, and we're entering exciting times, which I'm very proud to be a part of.